Morning. My name is Dr. George Musa. I'm a medical geographer from Columbia University, and I am the principal investigator on the Guyana Wellbeing Study and a faculty member of the GRIT, which is the Guyana Research in Injury and Trauma Training Program that will be started at UG fairly soon. We have wonderful guests here today. We'll start with Dr. Troy Thomas, who is the Dean of the uh, Natural Sciences at UG, as well as the Director of the Undergraduate Research Program and a statistician. Dr. Keely Cheslack-Postava, who is an environmental epidemiologist and the resident biostatistician with our Global Psychiatric Epidemiology Group, and she's the analyst for the Guyana Wellbeing Study as well. And Dr. Qixuan Chen, who is a biostatistician, a sampling expert, and also involved in the Guyana Wellbeing Study. She will be the one responsible for selecting the sample. And we have Ms. Alana Day, who is a statistician with the Ministry of Health, a senior statistician with the Ministry of Health. And the forum for this session is basically an open forum for anyone who wants to ask any questions about how to do research, how to do analysis, anything related to the work that all of you do. If I could just ask each of the participants, starting with Dr. Troy Thomas, to just introduce a little bit of background of the kind of work that they've been doing recently, so that the members in the audience can familiarize themselves more with their immediate work. Thank you.
Thank you, and thanks for the introduction. Well, as you indicated, I work at the University of Guyana, and I've been there since 2005. My work mainly involves collecting and using survey data, a lot of issues related to developing instruments, determining sample plans, measurement of constructs. Well, that's part and parcel of developing instruments. And I mainly focus on cross-sectional data. And that can include a variety of techniques and methods of analysis, inclusive of methods that address latent variables as well. I don't know what more I should say about that. I guess we'll see what the questions are and how we take it from there.
Dr. Cheslack-Postava?
Sure. So I'm an epidemiologist by training, and so really my work is on a variety of analyses relating to the analysis of data from epidemiologic studies, typically psychiatric epidemiology. With GPEG, these are typically longitudinal studies, so looking at multiple waves of data, often in somewhat smaller sample sizes. By smaller, I mean in the maybe 500 to 2,000 range, but observations over time. I also have quite a bunch of experience working on large national case control studies in birth cohorts, well, national and state level, I guess, some birth cohorts from specifically Finland and the state of California, looking at psychiatric outcomes in more typically with case control, analyzing data on case control study designs. Again, I guess so kind of broad. I don't know specifically, I guess I would also just say I'm always a big fan of sensitivity analyses, of looking at questions with data in kind of different ways of figuring out, what can we do with the data to test different issues, or to really to look at things in different ways to kind of make sure we've gotten the, really all that we can out of the data. Thanks.
Thank you. Dr. Chen?
Hi, good morning, everyone. So my research have a main focus on the development of novel statistical methods to deal with the analysis of a complex survey data, data with missing values or with measurement error. And the tool I primarily use is Bayesian hierarchical modeling. So the method I developed for survey data can be improve efficiency for a rare disease. For example, for suicide, it's a really rare disease, and in a general traditional method, it requires much larger sample size. But using my method, we can allow have a smaller sample size, but still get pretty good accuracy and precision for the estimation. I'm also interested in the application, not only for general health research application. I'm also interested in novel way of application of existing methods that have been used in certain fields. And for application, I have been working on environmental health sciences, mental health research, and other medical research, because we're in the medical school. And I'm also teach survey design and analysis at Columbia for graduate program.
Thank you, Dr. Chen. Ms. Day?
Thank you, Dr. Musa. I am, as Dr. Musa introduced me, the senior statistician acting at Ministry of Health. Over the past 10 years, I would have worked primarily on analysis, health statistic analysis, both regional and at the national level for all aspects of healthcare delivery. However, I do mainly descriptive and some bit of qualitative and quantitative analysis. And I would have also worked on a number of projects with PAHO in collaboration with Ministry of Health. Some of these projects would have included recently the telehealth survey. And I would have also conducted a survey for PAHO in collaboration with Ministry of Health on the effectiveness of the tobacco campaign. And the Bureau of Statistics as well. I would have worked on a number of projects with them as it relates to quantitative surveys and analysis.
Thank you. We'll start with a question from the Zoom audience. What is the scope for collaboration on research between overseas-based Guyanese and UG? I'm not sure, maybe Dr. Thomas, maybe you know of any collaboration between overseas Guyanese?
I think it would depend on what we're looking at the moment. You can have a lot of informal linkages between individuals where they might work on perhaps smaller projects. So I may have a colleague at another university overseas, and we might come together to work on something that really just relies on making a connection with somebody. On the other hand, if it's something focused on Guyana and you don't necessarily know somebody, you can contact the department or the university, and that department or whoever you may contact with at the university will work to put you in contact with the right people who might be able to advance the work. So there is scope and there is possibility, and I've known of many research collaborations and projects that took that approach, and things were able to progress well, and we had successful projects. So I'd say if you have something like that in mind, contact somebody who you might know, maybe check the website, and that individual should be able to channel your query or request in the right direction. And once there is mutual interest and the expertise available, I think it's something that can be done.
I'd like to add that we from the Global Psychiatric Epidemiology Group are both here in Guyana, obviously with our wonderful study, as well as overseas in New York, which New York has the highest concentration of Guyanese outside of Guyana. So if there's ever anything that we can do to help foster collaboration between U.S. New York City area investigators and Dr. Thomas and other investigators here in Guyana, would be more than happy to make that connection. Are there other questions from the Zoom audience? So unfortunately, our panel is not the most visited one, as you would expect, right? It's very
yeah, that's
so there are a couple of people that are just coming in, and I'm hoping that maybe they have questions that they would like to ask the statistical panel. Questions? One second. No, if you'd like to ask the question from the panel, this is the panel about statistical analysis. Do you have any questions?
Good morning. My name is Winifred Razak, and I am aligned to the University of Guyana School of Medical Sciences, and I have a lot of qualms on analysis. So, at the moment, I am involved in studies related to COVID-19 impact on nurses. And we're looking at the psychological impact here. Now, the idea we had was to do something that is using a mixed design. The persons who are involved, who are supposed to be conducting this research, are actually working in the situation. Here I see a good opportunity for nativity, for researchers going native, because it's a prospective study actually, and they're actually involved in the sample, even though that they are actually studying in the situation, you're actually working in the situation. Can I ask you about having that within the design, nativity? I know we're talking analysis here, but I'd like to ask a bit of methodology. Is it practical?
So I just to summarize the question, I think the question was in a mixed design where it's more of a participatory setting, where the investigators are also part of the sample. Is that the question? So the investigators are also working in the same area, and they're also filling out surveys. Is it a survey design? They're going through the same process, and the process. And after that, are they being asked to fill out a questionnaire of some sort? Okay, so some of the investigators are working in COVID. It's a COVID study, and please correct me if I'm wrong. So it's a COVID-related study where the investigators are not only providing treatment for the COVID patients, but also completing and during the sequela of the of COVID, but then also filling out questionnaires that becomes data as part of the study. And is there a confounding in being both a participant as well as an investigator And how would you handle something like that in the terms of the methods, in the terms of the design, and maybe in terms of the analysis?
May I clarify one question? When you talk about the investigators, they also participate in the study. Do you have many like? So we have two groups. One is investigators, and they play a dual role. They are investigators. They also are clinicians participate in the survey. In this survey, do you also include other clinicians?
I don't get that.
I think the question is, is it just investigators, or are there also clinicians and other research staff that are both providing care and filling out the questionnaires? And what's the proportion of your sample that would be those that are helping to design the study as well as those that are not?
Okay. 5 of us are involved in designing the study. Initially, there would have been no empirical evidence in this case since it's very new and it would be a first of this nature. Now, in our work up, like our justification and our review of what is there, we would have stated our experiences with COVID-19 as individuals. And as we go along in this whole thing, if it's 5 of us, 2 out of the 5 have already suffered infections. And most of us were quarantined or isolated because of some exposure. So we're all actually, we were investigated, 100% having 100% have endured the secret in some way or the other. So I saw that as a avenue for nativity, being part and parcel of the phenomena we're studying. So I'm wanting to know if it is some ideas on having that as part of the study, be going native, because you're actually there in its perspective.
So I like to start by saying my personal belief is anything that you take personal makes your research better. If you feel a strong attachment to the thing you're investigating, you become a better researcher by it. I'm still not clear on, first of all, how many participants are part of your study and what proportion of those participants are those that you're referring to that are part of that are clinicians or doctors or nurses in the study as well as participants.
No, all the participants are nurses. All the persons who were this whole sample, nurses giving care. And that is about 175 persons. And they're being studied by 5 researchers, 5 investigators are studying them.
So there are 5 researchers, and then there are 175 nurses. And in the survey sample is 180. And 5 of those 180 are the researchers that have also been exposed to and had COVID. Okay. So thank you. So how would you deal with this in terms of methodology uh, and also in the analysis?
Yeah, thanks for clarification. I think the main issue or concern here maybe say, oh, if these 5 investigators, their response will be biased toward the outcome of the interest. If they provide honest response as other investigator without like prior hypothesis, I think it should be fine. But one way I would recommend to do is that maybe some sensitivity analysis can be conducted, like force analysis, you use all of them, and then you repeat analysis by remove these 5 individuals and see if the conclusion will change.
So so she can take some notes. So the suggestion is to run a sensitivity analysis. So run the same analysis twice, one with all 180 and one excluding the researchers, the 5 researchers with the 175, just the nurses, and to see if there's a difference. Does that help? Any other additional questions? Oh, sure, no problem. We have another question. Trying to read this from the board. Guyana is ripe from Dr. Isaacs in the UK. Guyana is ripe for research from an epidemiological point of view. How can such research be conducted? Is a UK psychiatrist, UK-based psychiatrist, and would like to engage in mental health research in Guyana. How can we go about this? That's an easy question. Contact us at guyana.wb.conference@gmail.com, and we'll be more than happy to help you connect either with our group or some other groups here in Guyana. Any other questions from Dr. Isaacs or anyone else? One from the audience again.
Again, I'm going to ask another question based on the study. We're using the SPSS for data entry as it relates to the quantitative variable. What I'm interested is in a software that lends to qualitative analysis, because there's also focus group discussions within this investigation.
If I may, for the qualitative analysis, I mean, there are several tools available. I think NVivo is probably one of the most well-recognized tools. And this is, I'm assuming, it's a case where you collect data that you will ultimately transcribe, or you have in some sort of recorded, either a document or an audio or video format. And then you might want to code it and then analyze for themes and so forth. If that's the case, then a software like that, there is also Atlas TI. And I mean, I can list examples, but hopefully I'm just pointing you in a direction that you can look. If it's just a few, and you don't have software, you don't absolutely have to invest in software to do it. If it's just if your data, if you just do a few, say, focus group discussion 1, 2, 3, if you do more, the burden of analyzing that becomes greater, and then a software would be useful. So that would be my advice. You can, if you're looking for some of the most well-recognized software, I think those are two that I mentioned there, but there are others. And depending on what you want to do as well, I made some assumptions about what you might be doing to provide that response.
So I would like to add, qualitative analysis is quite different than quantitative analysis. Before you can run quantitative methods on the qualitative analysis, you need to do, most common is thematic analysis, right? So come up with the constructs and the themes, and then use coding system that can then be created quantitative variables that you can then run your statistical quantitative analysis. So as Dr. Thomas says, the reality is you don't need special software. It's better to have the software, but NVivo and Atlas TI, they're somewhat expensive. You can actually do it on Excel, as long as the coding scheme is properly applied, and as long as you have multiple coders, at least 2, and then you can check the reliability across the 2 coders. It's a different methodology in terms of just running analysis.
Basically, that's what we've been doing over the years, converting. But I would have liked to expose my team to the right thing we're supposed to be doing, using the software that is available.
Great. One thing that actually we use NVivo for sometimes as well is literature review, because it's a great platform. You bring up your PDF, you can highlight within it, you can create, and then it actually saves all your notes. And then, so in essence, that's what qualitative analysis is. you're making so you can do that within your article that you're reading, so that when you go back to do compose your literature review, you already have all your notes prepared and your PDFs in one place and highlighted. So it's more flexible than you would actually think. And Vivo and Atlas TI, and both of them are very, very similar. Both of them do the same thing. Both NVivo and Atlas TI, they do very similar applications and functions. Great. Can you please repeat that? I'm sorry, Ms. Maritza. Which part did you ask us to repeat? Okay. Any questions and other questions? Yeah. Sure. I don't think there is anyone. So, if other questions come up in your mind, feel free to reach out to our email, and we'll be more than happy to connect you with the panelists.
I just need to add some more to your, I'm not sure what the objectives of your research. You're not hearing me? Oh, sorry. I'm not sure what the objective of your survey is, but based on your objective, that would be a starting point in terms of selecting your sample size. For a large sample size, if you're going to be dealing with a large population or a large sample size, because you mentioned that you're going to be using SPSS. SPSS is for large sample size, large survey analysis. There are many other tools that you can use. For example, like eViews, you have Stata, you even have EpiInfo. EpiInfo is a very simple medical software that you can use, and it's for free. You don't have, there's no cost attached to the EpiInfo analysis tool. You can download that for free, but that is mainly for if you have, if you're gonna do basic qualitative analysis, right? But for more advanced statistics like regression and parametric studies and so on, SPSS would be more helpful. A bigger or a larger statistical tool like SPSS or Stata would be more useful. Another thing in terms of your method, how you're going to go about collecting the information, because we're in a pandemic and there are other tools that you could use like Qualitative. I don't know if you're familiar with Qualitative, but it can actually assist you in designing your survey tool, and you can send that survey tool virtually, or the questionnaire, you can send it virtually to whoever your audience, whoever your respondents are, instead of going wrong to them in person, face to face. You can actually send the survey through Qualtrics for them to do it virtually and get the feedback. And Qualtrics have an analysis tool that actually helps you to analyze the responses and so on.
Thank you. I like to add a little to that, actually. Qualtrics is a great platform. The challenge is that the data resides in the Qualtrics online. And we at Columbia are always a little careful about where the data sits. I think a better platform is more complicated, more advanced, but it has wonderful tools as well. It's something called Redcap, which is from Vanderbilt University, and it's free as long as the organization registers with it. We're trying to establish a Redcap system here at the Bureau of Statistics, but maybe we should establish one at UG as well. All you need is a server and an administrator that can keep an eye on things, and we can help you set it up so that you can conduct interviews not only online, but also through your cell phones, through a downloadable app that even if you're in the hinterlands where you don't have internet access, what one of the limitations of Qualtrics, you can collect data on your phone using the Redcap engine, and then once you connect it to internet, it automatically uploads the data into the Redcap server, which is housed at either UG or Bureau of Statistics or the health department, and then you can analyze your data that way as well.
I like this discussion though because I'm getting some tools I can work with. Basically, we had entered the data, the questionnaire, the tool, into the Google Classroom platform. Why we put it into the Google Classroom platform? It's because most persons can use their WhatsApp, to access the survey through that platform. There's also an analysis component that goes on. Each person's that once they submit, it goes straight to the analysis in that program. The issue there is that you like to do your commercial alpha testing after you've had the data. So there's an Excel sheet that you can use to look for the reliability. Something I've noticed with one of the surveys in the pretest, and that was a survey with secondary schools on COVID-19. In the pretest, the commercial alpha was very favorable on the 200 persons for most of the scales. But then when we got to the post-test, the real research, one of the scales that had a favorable commercial alpha on the 20 is having a -1 something. It's so different in that scale, right? It makes us question.
So just to make sure I'm understanding and the panels are understanding. So you use a classroom platform that is attached to WhatsApp to collect your data?
What most schools at the moment are teaching via the Google Classroom platform. So you find that that software allows the teachers to communicate with the students via that platform. So we use that same platform to put the survey out. We pre-tested it, so when it goes, the person can have a cell phone, it comes there, question by question, and it does not, another question is not available until one question is answered. And when they submit, it goes straight to the analysis, which is done within the same program. But then because we want to do other tests, we would use the Excel sheet to input into our system to do other tests. Why sometimes we use SPSS because it's available. It's available to us. And if we want to do like compare means and we want to run things like ANOVA and regression and so depends on what the type of methodology was and what we were actually questioning, then that platform suits our purpose. So that's why we've been using that platform. But then we have a mixed study now. Then I was suggesting that we use software that communicates with that sort of analysis. Have the practice in using that sort of software. And that was it. Now, I like the suggestion by Doctor about the software that we can access. I think that would be an asset to our program, our teaching programs. Also, I shall examine the platforms that Dr. had, Ms. Day has suggested for us. I'm very interested. This sheds a lot of light because I'm actually involved in annual research with students, and all that I can get here will be very beneficial, not only to me, but to the students to come. Not only for this year, but all years to come. So I'm taking very keen interest in what is being released.
Well, thank you for your interest, and thank you for. I know of Google Classrooms. I've used it to teach. I've never thought of it using as a survey collection platform. I think that's very, very insightful. Yeah, very, very. So you conduct your survey in classrooms and then you export the data into Excel so that you can run regression and you can run the additional tests that you do in SPSS and so on. That's very, very interesting.
You would have mentioned that you use the Google Forms. That's enough. You would have mentioned that you use the Google form as a method to construct your questionnaire for the survey and send it out to the respondents so that you could get back the responses. That is another way you can do the survey, and I guess it's a safe way apart from Qualitative, because like Dr. Musa mentioned, Qualitative, because it's a virtual database, persons might have security issue using it. So to be safe, or if you have security issues, you could use the Google form to administer the survey. However, you also mentioned that you would have inputted the data in Excel. What you need to know when you're using SPSS, it is better for you to code the data directly in SPSS, right? That is the only way you would get to set the data level. For example, whether it's ordinal or whether nominal data, you get the option to set the levels and to code the responses and so on.
I just like to add, I think what she was implying is that she exports the data that she's collected into Excel, so then she can then import it into SPSS. So I don't think you're doing any manual coding in the Excel, I'm assuming, correct? You're exporting and then importing. And when you import it, you can set in the import statement, is it nominal, is it ordinal? And you can set all that as long when you're importing it. So you don't have to key it directly into SPSS. You can import it from Excel. And then as long as your import statement is correct, you're just as good in the other way.
For some persons, because the very first time, I can tell you from experience, the very first time I used SPSS to do analysis, I would have entered the data on an Excel sheet. And when I finished, I would have imported that data into SPSS only to find that it all depends on how you enter the data. When you would have imported into SPSS, if it's not done the correct way, SPSS tend to reset your settings, right? So for me, I feel comfortable working directly from SPSS. Some persons might want to use the Excel sheet first and then import it. It all depends on your preference, but for me, I prefer to do it directly from the SPSS software.
I would yeah, go ahead, Keely.
Oh, yeah, yes. I mean, I was just going to add that I think it does depend on kind of thinking about the use of your data and what are you going to do with it and who is going to use it and who might want to use it, how, if you will be only having it analyzed in SPSS, you could consider that, but if you, if you want to have it available for different people to use in different programs, it may make sense to have a more basic format that will be imported into different programs for different uses.
I would like to add, I agree on your statement about SPSS resetting your values and such, and that's how the Excel. One of the issues with entering any data in Excel is that each cell is independent of everything else. So unlike SPSS, where each column is either a string or a numeric, in Excel you can put pictures in there if you wanted to. It doesn't really matter. So when you then bring it into, so if your column is mixing up data types, when you bring it into SPSS or SAS or Stata or all the others, it's gonna either change everything to string or it's gonna have a lot of missing values for for those cells that did not match the original type of the first row. A better way to enter data is neither Excel or SPSS, is to use something like CS Pro, which is freely available from the US Census, CS Pro, and also EpiInfo. I'm not sure if EpiInfo is still available. It is still available. So you can set similar restrictions in EpiInfo so that when someone's entering in variable gender, they don't enter in Henry as opposed to male and something like that. And then thus, when you bring it into your analytical platform, whether it be SPSS, R, Stata, whatever, you should not have problems.
Let me ask a difficult question. I mean, it poses a lot of difficulty for me because if I am analyzing, I would like to run analysis on data that has shown preferable from Alpha readings, 0.7 up. How do you handle your data that has shown of indices below the required margin? How do you go forward? What I normally do is to not follow analysis on the data or the scales that are showing the lower indices. Now, is there another way forward? Is there a right way forward?
I was going to follow up on that issue based on what was said about a negative coefficient or a negative value for either the scale or some item. It really does start with ensuring that the instrument is constructed well and tested rigorously. My general advice to people who are more so interested in finding results, real results, I might dabble in things because I study the method and the techniques. But if you're more so interested in the results of the application, then it might be best to first of all start with instruments that have been developed by experts and instruments that have been tested and been shown to have the right properties. That notwithstanding, there is always the possibility of cultural moderation, wherein the items may not function as they are expected to function depending on severe cultural variables. People might just think of it differently, or something might just not be relevant in a certain culture. So I would start there. Now, if you're developing your own instrument and you test it on a group, if the group is, and I'll use the size of the group as a proxy for the test group or the pilot group being a random sample of the population. If it's not a true random sample of the population and not representative of it, you may find that the results from your pilot will be a particular result, so that when you go to the larger group, you may not really, the instrument may not work in the same way. And I don't know to what extent that is what has happened in your case, where the pilot group was not truly representative in terms of how they view the items and how they respond to it, of the larger population to which you substantively applied the instrument. So there is something going on there. And one test of an instrument is not necessarily enough to establish its properties. You may have to go through a few iterations. So you can expect certain things to happen. The results shouldn't be drastically different, but sometimes they are. One of the things you can do is, and I'm assuming it's a multi-item scale, it has to be, and you want to have one measure coming out of a set of items. One approach is to trim the scale, to remove the items that are causing the problem. What you will have then is perhaps a construct that doesn't fully convey or capture what you wanted to capture, but it would be better than nothing. If you had several items in there, hopefully the measure is stable enough so that removing one item does not throw everything into chaos. So that's something you can check. Check also the coding of your data. Did you ask all the questions in a positive manner? Or did you ask some in a positive manner and some in a negative manner? Because if they're going in opposite directions, that can affect the value that you have. You may have to recode it so that they're all going in the correct direction. But you don't do this based on the results. Do this based on reading the items and making sure that they're going in the same direction. So I wanted to suggest that you look back at the questions, make sure they're going in the same direction, look at the way you coded the data, that they're not going in opposite direction. And then you may want to test which item is causing the problems and remove the item and see what you have. It might be a limitation of the analysis after that, but I think it will be better than having nothing at all. And generally, Cronbach alpha has its limitations. And I don't usually recommend it as something we should strictly use. I would recommend other methods, but those methods would perhaps require larger sample sizes, where you might use a latent variable approach. Like if you're thinking of it as a continuous variable, maybe factor analysis to establish the properties of your scale. So Cronbach alpha can be affected by the number of items you have in the scale, and no doubt by other things as well. So I don't think it's the end of the world if the Cronbach alpha isn't where it is, but you might have to inspect it and really check to see whether it's being affected by other things. But you always have the option of reducing, modifying the number of items or the items in the scale so that you might have a slightly different measurement, but something that still gives you useful results. And use that which you would have learned here for the next iteration so that you can improve the scale itself.
Thank you, Dr. Thomas. Yes, we've been looking at the items that we can delete because that just allows us to do that. Where we see the items that we can delete and have a better conversation. We've been doing that. But as you rightly said, we're going to go back and look to see the coding. That's something I can work on. And ensure that we have followed everything that will have been in the right way, not to affect the reliability of the data. Because as I said, we try to analyze what is reliable according to the data. Now, the question I was asking, what do you do with the scales that you found out? How do you handle them in your results and discussion and all that? Those scales that are not reliable, because normally, if the scales don't look reliable, those scales that are not reliable, I do not do further analysis on them. I analyze and report on the things that are reliable. Now, I'd like to hear from you about the handling. What you've said, right, is that the commercial is not gospel. But just give me some more talk on what I do with the unreliable scales if I go all the way and they remain unreliable.
How many items you had in the scale to begin with?
6 items. Normally I go 6 to 8 items per scale.
In the most drastic case, there might be some scope for analyzing the items individually if nothing really works. But that would really mean that the scale wasn't constructed well, ultimately. I don't know if that's answering your question, but you can go the route of having individual. There is really no statistical procedure you can apply to data that is not measuring what you want it to measure. It's not possible to correct it with statistics. But when you do the analysis, you can report the limitations, report what you had to modify in terms of your approach to achieve what you're achieving. I don't know, maybe other panelists have other advice.
Yes, I just wanted to add this other point because since you mentioned, I just need to add another point since you were mentioning scale. In terms of the variables, because I would have worked on a private consultancy as it relates to a particular survey. And what I found was that the variables that the individual was actually using, most of them, they were independent variables, right? They weren't actually capturing information for dependent and independent, right? So a lot of the variables were I guess it was misconstructed. So when I would have run the analysis, there were a number of errors coming up. Like you would have mentioned, the negative figures and so on, that, things that don't actually make sense when you look at the coefficients. It makes absolutely no sense. And that is because it was largely contributed to the variables, right? Because once you know your dependent variable and your independent variable, you would be able to construct your questionnaire, design your questionnaire instrument in a way that you can capture data for both variables. Another thing, you can actually do a variable analysis. I can't recall the direct name because I would have done this like 5 to 6 years ago. I think it's the factor analysis, whereby you actually test the variables that you're using, and the factor analysis would tell you whether you should drop that variable or whether you should keep that variable, right? If the variable adds to your analysis, whatever test you're doing, if the variable adds positive results to your analysis, you keep it. If not, you just drop that particular variable.
Dr. Chen?
Yeah, I feel like I cannot give very concrete recommendation here without looking at the data and the actual problem. But usually I would recommend do more visualization to learn more about the data set, because sometimes maybe data have some inferential observations that can change the result you hope to see. And I think latent variable analysis would be good approach. But again, I always like to recommend to start with the data, to know the data better, and using different visualization tool to see what's going on. For any scale, if it's not validated before, maybe would be based on some hypothesis to see, because it need to be tested if that is, as Dr. Thomas say, maybe the tool developed not exactly the measure you hope to collect. And usually in design questionnaire, we recommend research investigators to go for some national surveys, those well developed questionnaires, start with those, validate the questionnaire and do the data collection. And if need to do something really new, maybe needed more like validations before it was implemented in a larger scale of data collection.
Go ahead.
Sorry, I was just going to kind of add in that I think, this might be one instance where, again, it's hard to say without actually seeing the data. I don't know really what's going on, but one thing is that maybe if you have some questions or some items there that are kind of behaving differently than you expected. This might be one issue where the question about the investigators also being participants could come into play, and that sometimes as investigators, if we're just, if we're thinking, what is it that we want to capture and how to ask that, and we write a question and think it's getting that, maybe we the investigators understand exactly what we were asking and will answer it the way we expected, but it may be that your other participants reading this question are interpreting it differently, and so that would be something maybe for the future, being sure that it's not kind of additional pilot testing, but so again, without looking at the data, I can't say, but that this could be also an issue too, that maybe you have questions that weren't interpreted kind of as you thought, and I think we've certainly seen that. I've seen that too. So
thank you. Yes, we're basically out of time, but I just want to add a couple of things. That it actually goes back to the data entry questions from before. Exploratory data analysis is always the first step of analysis. I'm sure you've done it, but are there any outliers? Are there any out of bound values that may be affecting the variables that your scale is constructed from? Okay. So if you want one quick last question, and then we really have to wrap up.
Believe me, all the information I'm getting, I feel is very vital. But the phenomenon I'm talking about here, I've used the anxiety state and trait questionnaires, which are tested tools. And I've had similar responses among certain populations. I do buy the part of culture or person's understanding and how they see it. That's what I'm saying. All the information I'm getting here has a lot of meaning to me, because it's actually attaching to some phenomena that I've uncovered. With the anxiety state and trait questionnaire, I found it unreliable on a sample of 20 and a random sample. I found unreliable on a sample of 200. I'm testing the questionnaire. I've tried to rearrange the way it was offered the first time. You say, look at the methodology. I found on the sample of 200, the anxiety state unreliable, anxiety trait reliable. And these are tested instances. I'm going to the discussion coming from doctors, that it operated differently within the different populations. Probably their understanding of what was asked. So that's what I'm saying. All of it coming over to me here has a lot of meaning. It gives me a lot of things to think about. About our, sometimes with a lot of independent variables, most times because it's the variable that is influencing the outcome. We find most of it will have a number of independent variables as the influencer. And then they have the outcome variable, which, would be the dependent one. So, in our surveys, we often take time to ensure that when we look at our research question, what question and objective, we're moving towards an outcome. So our variables fit along the line. However, I'm still going to go back and examine these different stages to see, because I really want to know. As I say, this discussion helps to build my bank of activities for the future, not only the researchers that are going to this year. It's every suggestion I'm going to take very seriously. This thing it also occurred with instruments that were tested reliable at a global level, like anxiety, state, and trait. All right. So I'm looking in on the cultural aspect, because sometimes I know back we used to try to make some changes with our instruments to ensure that it has cultural semblance. But then when you have someone's instrument that is made, you cannot go ahead doing that, interfere with someone's instrument. However, I am going to put into thought and action some of the things that I have here to ensure that it takes me closer. The question remains to me, what do I do with the data that proves unreliable throughout all these processes? Should I discard, or to what level report on them? As for the sample size, we try to use sample size that are actually 20 to 40%, 20, 30, or 40% of the population in nursing. So if we're dealing with a population, so I believe 500, because we want to sometimes make generalization or just inferences. So that's why we choose a size that can allow us to do what we have to do in reporting, in our discussion and so forth. And that's the kind of thing with selecting the population that we're going to use, depending on what we're using the study for.
So we have 5 seconds to, I think, try to answer a very complicated question without looking at the data. And I think all the panelists would probably agree. Without looking at the data, it's hard to recommend what you would do with your results. Maybe we can set up a consultation with Dr. Thomas or Dr. Cheslack-Postava or Dr. Chen or Ms. Day to help you look at the data in a different way and to maybe help you identify what may or may not be problematic. As far as the state and trait anxiety scale, as Dr. Thomas said earlier, cultural adaptation of questionnaires is very complicated, very difficult to do. And first, I would suggest you look at the literature to see if this questionnaire has been used in any of the Caribbean population before, to see if they had similar findings, because what you are discovering may or may not be the same as other folks using the same questionnaire within similar populations. Was anything else that anyone else would like to add real quick?
I think I was just add, I think the question about what to do with your data in terms of keeping or throwing it out, that I would say just whatever you choose, you don't just get rid of it. If you have a rationale for not, for in the end not using certain items or certain data, certain observations in your analysis, that you should always have, you have to have a rationale for that and be able to explain it, and you should explain what went on, and not just throw it out. It's you have a rationale and explain it. So in general, I would say that.
Yes, thank you. I think we could all agree with that. So thank you so much for everybody for the wonderful discussion, and thank you.